I believe that the kind of person you are and the attitude you bring to the helping relationship are the major determinants of its quality. The knowledge and the skills that you need can be learned in courses such as this and in your field work. Knowledge alone, however, is insufficient, yet without it you cannot be an effective helper. If you focus only on learning the skills and neglect the theory and knowledge, then the skills will have little value. Helpers who have little self-awareness are at best skilled clinicians with a limited ability to make a difference in the lives of the clients. The bottom line is that the helping relationship is based on the skills and knowledge, but that it is put into use in creative and unique ways. It is both an art and a science. Here is a summary of the differences between effective helpers and ineffective helpers. Effective helpers hold positive beliefs about people. On page 159 in your textbook is a brief self-survey about beliefs about people. Please take the self-survey to understand your own beliefs. The definition of effective helpers is that they hold positive beliefs about people, have a healthy self-concept, ground their interventions in theories, and we're going to cover theories in the next chapter, and possess empathy, congruence, warmth, compassion, genuineness, and unconditional positive regard. You may have had limited experience with people from other cultures, worldviews, and circumstances. Take a quick moment to think about your life experiences so far. Have you had the opportunity to live in other places? Have you had the opportunity to visit other places? What was it like to learn about different cultures? Think over your life history. What types of family experiences have you had? What types of personal experiences have you had? Perhaps you may be in recovery or previously experienced a variety of different issues. Even if you have not had negative experiences that you have overcome, you may have had positive experiences, such as a normal family and a happy childhood. You can also use these positive life experiences to provide hope and encouragement to others. If you have lived in an encapsulated or a limited environment, you may only see what confirms your existing belief system. This is known as confirmatory bias. Direct contact with populations that are unfamiliar to you is the best way to learn about people whom you might have stereotyped. Approach these situations with an open mind and a curiosity to learn as much as you can. The stages of change is a theory that I really enjoy teaching about. In the 1990s, Prochaska and DiClemente developed the stages of change. This was based upon their research and work with cessation of smoking clients. And they discovered that there are somewhat predictable stages of change. It doesn't mean that they are linear, but generally people go through these changes as they are thinking about changing any kind of behavior. Pre-contemplation stage is the very beginning. The person is not really thinking about changing and is not ready to change. In the older days, we would say that they are in denial. They actually have no awareness of any problems. Contemplation is the next stage of change. The person is willing to explore change, but not ready to commit to change. I'll probably make that change within the next 6 months from now. Preparation is when the client is actually developing a plan. The person is ready to change but needs a plan, has begun making small steps towards the action. For example, I want to begin to exercise more, so I've looked up a couple of different gym options and am trying to make a decision about which one I want to join. I am preparing to make the change, but I haven't implemented the action change yet, i.e., getting more exercise. Then I enter the action stage, which is when we implement the plan. The person actually changes thinking, old habits, or behavior. Think of this as action. Changes have already begun. The maintenance stage is where the person is seeking to make changes permanent, and they have been working in the action stage for more than 6 months, and then they enter the maintenance stage. The goal in working with clients is to match your interventions to whichever stage of change the client is at. And your goal as the counselor or the helper is to move the client through the stages of change, only one stage at a time. Meet the client wherever they are at and facilitate a dialogue that helps them move forward. The helping process is a collaborative endeavor in which both parties share the responsibility for making change happen. Many counselors use brief interventions. Brief interventions are time-limited, solution-focused, structured, effective strategies that can empower clients to make specific behavioral changes they desire. Practitioners who operate from a brief therapy model are actively involved from the beginning, establish a collaborative relationship with their clients, are ever mindful of termination, summarize each session, and with clients devise homework to be carried out between the sessions. At the end, there is always an open door policy in brief therapy, meaning that the client is invited to return to counseling in the future to make more life adjustments. Think of brief interventions as solving one problem at a time in smaller chunks. This course is about an introduction to becoming a helper. It is a broad overview of the skills, knowledge, and attitudes that you will need to be an effective helper. In this chapter, we outline the general framework of the phases of the helping process, and they are not linked to any particular theoretical approach. There are 5 stages, each stage with a set of particular tasks to be accomplished. In addition, in each stage, the helper must utilize specific skills. Keep in mind there is considerable overlap between the stages. Stage 1 is all about establishing a working relationship with your client. The only important factor in helping the person make changes is the quality of the helping relationship. Your collaborative partnership with your client will determine the outcomes. Helpers are expected to create a relationship in which clients can reveal their story, identify what they want to change, and attain a new method of dealing with their problems. How do we do this? In order to create an effective helping relationship, it is of paramount importance to assist clients in becoming aware of their assets and strengths, rather than concentrating on their problems, deficits, and liabilities. For clients to feel comfortable to talk about themselves, we need to provide attention, active listening, and empathy. However, an effective helping relationship is not always positive, but rather the helper must also be able to support and challenge their clients. Being genuine is another important factor to creating a working alliance with your client. In stage one of the first tasks is to educate clients and obtain informed consents. Informed consent is where the client needs to know certain questions. It begins in the first session and continues throughout the stage one. How is confidentiality protected, and what are the limits of confidentiality? How does the therapeutic process work, and what is the primary role of the helper? What is the approximate length of the counseling process? How will termination be handled? What are the main rights and responsibilities of a client? What are some of the main benefits and risks of counseling? You need to remember that not all clients who come to you understand these questions, and it's really important to provide them the answers and the education prior to even beginning your relationship. During the second stage, the central task is to gather information, conduct an assessment, identify the client's problems and resources, and assist clients in setting their goals. Typically, people become clients either because they recognize they need outside help to understand and cope with their problems, or because someone else suggests, or in some instances mandates, professional interventions. Clients often need assistance in identifying and clarifying aspects of their lives that are not working for them. This is called assessment. Assessment consists of evaluating the relevant factors in a client's life to identify themes for further exploration in the counseling process. After assessment, diagnosis consists of identifying a pattern of symptoms that leads to a specific diagnosis, usually by using the DSM-5. More and more agencies now rely on initial assessment and a DSM-5 diagnosis for reimbursement purposes. Realistically, diagnosing is an ongoing process throughout the whole counseling relationship. In the third stage, the helper and the client collaboratively establish goals by determining the specific changes desired. The goals refer to the desired outcomes of the helping process that are agreed upon by the helper and the client. From a strengths perspective, the helper pays attention to what the clients do well and to their resources. Collaboration is work. Really listen to your client during stage 3. Process their feelings about the changes that are desired. How will they know when they have changed? What is success to the client? For example, your client may say, "I want to be more healthy," as a goal. But what does this really mean to them? Break it down. Does this involve healthy eating? Does this involve healthy sleeping? You may be thinking, of course it does. But your client is really thinking, "I just want to get outside and walk a little more." A common area of new counselors is to move too quickly into the problem-solving mode without a clear joint understanding of where it is that the client wants to end up. The fourth stage of helping deals with exploring the alternatives, identifying strategies for action, choosing which combination of strategies will best meet the client's goals, and then putting these plans into a realistic action program. The helper's role is to facilitate the clients in gaining new perspectives, seeing situations differently, and encouraging them to do things differently. Knowing what you want to change was step 3. Now, knowing how to bring about that change is the 4th step. Confrontation and self-disclosure are both very important aspects that can further client exploration, can lead to new insights, and can encourage clients to take action to achieve their personal goals. Many of you are coming from a variety of potential helping relationships, not just counseling. You are coming from nursing, case management, criminal justice, social work, and others. However, your goal is the same: to have the client take some action towards behavioral change. A definition of confrontation invites individuals to look at discrepancies, incongruities, denial, distortions, excuses, defensive behaviors, and evasions that prevent them from taking action to change their lives. A lack of challenge may also result in stagnation. So, helpers who seize being effective catalysts to others' growth, if all they do is support, it takes a balance of support and confrontation. Confronting clients effectively entails on focusing on their awareness of what they are thinking, feeling, and doing. In other words, you describe what you observe. For example, John, this week we had a goal that you would only have 2 drinks on the weekend nights, Friday and Saturday. So what happened on Monday night when you overdrank and became drunk? The degree to which you challenge your client depends on how much they trust you. Confrontation is not intended to attack the defenses of the client. Rather, it invites them to examine their problematic behaviors and keep moving toward more effective behaviors. Confrontation is not done in an argumentative way, nor to make the client feel guilty or shameful. It is a matter-of-fact statement of the facts, allowing the client to assess their own behavioral patterns. Watch the tone of your voice, the utilization of your words, and your body language when using confrontation. Lastly, according to Wobholding, we make a plan. Effective plans have the following characteristics. The plan should be within the normal limits of motivation and capacities of each client. Plans should be realistic and attainable. Helpers do well to caution clients about plans that are too ambitious or too unrealistic. Good plans are simple and easy to understand. The plan should involve positive action and should be stated in terms of what the client will do. It is useful to encourage clients to develop plans that they can carry out independently on their own. Plans that are contingent on what others will do lead clients to sense that they are not steering their own ship, but instead are at the mercy of others. Good plans are specific and concrete. Effective plans are repetitive and ideally are performed daily. Plans should be done as soon as possible. Helpers can ask questions such as, what are you willing to do today to begin to change your life? Effective planning involves process-centered activities. For clients to commit themselves to their plan, it is useful for them to firm it up in writing, kind of like a contract with you. Stage 5 then is termination. Termination assists clients in maximizing the benefits from the helping relationship and deciding how they will continue the change process after the relationship ends. Ideally, termination is the result of a mutual decision by the client and the helper that the goals of the helping process has been accomplished. It is also helpful again to have an open door policy, meaning that in the future, as the client may need additional sessions, that they can come back to you, especially if you had a productive working relationship. Here are some termination tips. Remember to prepare for termination in advance, and it is helpful to space out the sessions if you have that latitude. Don't forget to have the clients talk about their feelings of separation. Now participate in the discussion forum on Chapter 6 and then take the quiz on Chapter 6.